Good morning, and welcome to the Shatkin F.I.R.S.T Monday Morning Minute.
Good morning, and welcome to the Monday Morning Minute. We have a special Monday Morning Minute this week. We're coming to you from outside of Jacksonville, Florida, in a beautiful part of the country called Amelia Island. And we're here with Dr. Dennis Flanagan, who is kind enough to invite us down to the Alabama Implant Study Group. And it's been a phenomenal day with Dr. Flanagan lecturing on the benefits of mini dental implants. So, Dennis, welcome to the Monday Morning Minute, my friend.
Good to be here.
It's great to have you with us. Quick question for you.
Yeah.
Why did you think it was important for this group of dentists, who are traditionally, I mean, it's one of the oldest implant groups in the country, and we learned all about it today, which Lenny and I are fascinated by it, and why is it a good time now for them to learn about mini dental implants?
Well, as you know, mini implants can't be placed just anywhere, and I think that there's a lack of information in the evidence right now, and it's slowly getting more and more evidence that benefits and explains the use of mini dental implants. But I think it's important that everybody knows the background of what can happen if you have a complication. Mm-hmm. I talk about this in my lectures, what to watch out for, and what to do to prevent complications. They can be anatomical complications or prosthetic complications. The idea is to control the occlusal loading on mini implants, because they do impart about twice the load on the bone as standard size implants. So you've got to take that into account. Now they'll take a lot of load axially, but off axially you've got to control that. So I think it's important to take this into account. Make sure everybody understands, the treating dentists understand this, so that they don't end up in trouble.
Right. And I know you touched on that today. You had a few slides on that particular topic.
Yeah.
But yeah, it was great that what you covered. Basically, what I got out of the meeting is that it's important to understand everything that's going on with the patient and how important it is to have a good grasp of all the different details and where to use these, when to use them, and I think it's amazing. And there are a lot of doctors who came up to Lenny and I afterwards and said that they've never placed a mini implant, but they want to learn about them. Yeah. So they're opening up their eyes to this minimally invasive treatment.
Yeah.
So yeah, I thought it was great.
Implant dentistry is a very complex modality, mm-hmm. and there's a lot of things we need to take into consideration: the patient's medical history, their drug history, and any previous dental history, including implants. Do they have a bad experience with implants? I mean, the teeth that were taken out, were they debrided appropriately? A bacteria can reside inside the bone, and then you come in later on in a healed site and put your implant in there, and it fails because of the resident bacteria, the vegetative bacteria.
Right.
So there's a lot of things to consider.
That was an interesting slide that you had on the cadavers. What they found in that study.
Yeah, that was eye-opening for me. I mean, that was done a number of years ago, but still, they found that they sectioned the different levels of cadaver bones, and they found actual viable vegetative bacteria living in the bone, the cadaver bone. And if you place an implant in that site, they'll colonize the implant and cause the implant to fail. So anyway, it's good to watch out for those things and know what to do when, so that if you do encounter a clinical situation like that, you can resolve it.
Right. When you place your own implants, I know that I've sent you some implants, and I know you showed 10, 15, 20 years of you placing mini implants in your lecture. Yeah. Do you think it's advantageous to place it with a surgical handpiece, like a 20-to-1 handpiece, or do you think it's better to have a tactical feel? What's your opinion?
That's a clinical preference. I prefer to use the handpiece.
Okay.
And then if the bone gets very dense, I'll use the thumb screw, the thumb driver.
Yeah. Okay.
It depends on the patient and what the patient's situation is. But I prefer to generally use the handpiece, because that gives me a number to insertion torque that I can use. And I like to put these in at least 32, 35 Newton centimeters, at least.
Right. Yeah, absolutely. And Dr. Shatkin talks about that in our courses as well, how important that is to understand, like where you can load them and when not to load them. And
he puts on a great course.
Yeah, he does. Speaking of courses, on February 2nd and 3rd, which is next week, we're going to have our first beginner's course of the year. It's going to be an intro course, so anybody who's never placed implants, come on out to Buffalo and we'll show you exactly how to do it. We also take a look at our 2024 schedule. We're going to have advanced courses in March. Gordon Christensen will be joining us this year, so we're excited about that. And hopefully we can get this guy to come out and to Buffalo and put on one of his great lectures like he does always.
It's always fun in Buffalo. It's always fun in Buffalo.
It always is. And it's getting warmer too.
Yeah.
So we're almost out of the winter. But
better not go there.
Yeah, right. We better not go there. Okay, so we're going to sign out here from the Alabama Implant Study Club in Jacksonville, Florida. It's great being with you, and have a great week placing your mini and mono implants. And don't forget, if you have any issues, give us a call. 1-888-4-SHACKIN. Have a great week. Thank you, Dennis.